Hi everybody, this is Dr. Ari Tuckman, psychologist, author, and contributor to Attitude Magazine, a resource for children and adults with ADHD. As we've done before, we're taking a question here, and in this case, we're talking about Oppositional Defiant disorder, or ODD, as it's often abbreviated. Now, the question comes from someone who says that they were diagnosed with ODD as a child and wanted to know if adults can have ODD and what happens to it and all that, which is, great question. So, yes, kids with ADHD are perhaps a bit more likely to wind up also being diagnosed with oppositional defiant disorder, especially if they tend to be hyperactive, impulsive, and, just generally kind of get themselves into trouble more often. The adult version of ODD is antisocial personality disorder. Now, that does not mean that people are not interested in being social. Rather, it means that they tend to do a lot of things that sort of break the rules, sort of intrude on other people's rights, things like that. Now, kids with ODD are more likely to become adults with antisocial personality disorder. However, this does not mean that everyone with ADHD is going to wind up with antisocial personality disorder, because the vast majority of them will not. So, having said that, let's not stress too much about it. But nonetheless, kids with ODD, many of them wind up just sort of calming down, settling down. Their brain kind of continues to develop, become a little bit less reactive, a little better at kind of pausing and thinking about the bigger situation and not just reacting to the immediate situation. Treatment certainly helps. That means medication, but it also means therapy. It also means, kind of parenting stuff, kind of helping the parents be more effective parents for what is perhaps, a bit of a more demanding child. So, there's kind of yet another good reason to seek treatment, and perhaps to seek it earlier rather than later. So, the answer to this is that, yes, ODD can persist into adulthood, but often it doesn't. And, hopefully if, people are diligent and they stay on top of things and they do what they need to, then it's even less likely to develop into something that's more problematic later. It's that old saying, an ounce of prevention is worth a pound of cure. So once again, this is Dr. Ari Tuckman. You can find this video and others at attitudemag.com. And I hope that you check them out and find them helpful. Thanks.